good afternoon. Why don't we get started? It looks like we have a large number of people here, and while folks are trickling in, we do want to be respectful of everyone's time. I'm Gordon Smith. I'm chair of the Department of Neurology here at Virginia Commonwealth University in Richmond, Virginia. Thank you very much for joining us for this webinar, Exercise and Wellness for Parkinson's Disease Patients in Unprecedented Times. We are recording the webinar, and we'll send out a recording link in the coming days so you can watch it again or share it with friends or colleagues. I'm really pleased to be joined by our friends and partners from Power Over Parkinson's, Gary Rogliano and Margaret Preston. They'll be helping to moderate today's webinar, and I'll introduce you to them in a moment. I'm also extremely pleased that we have a number of team members from our Parkinson's and Movement Disorder Center here at VCU Health. We're fortunate to have one of the best Parkinson's programs in the United States, and you'll see evidence of that in today's webinar. This is only a part of our amazing team, and I know you're going to really enjoy and benefit from hearing what they have to say. We have a couple of goals with the webinar today. I think the first is to provide general suggestions and tools to support a healthy lifestyle and wellness. This is something that's important for all of us, but particularly important for those of us who are living with Parkinson's disease or another movement disorder or neurodegenerative disease. We'll also talk a little bit about modifications in the healthcare environment and clinic that have been made in order to facilitate continued safe patient-centered care during this time period. But before talking to our panelists and introducing them, I'd like to introduce our moderators, Gary Rogliano and Margaret Preston. I was ready to take half an hour to introduce them, but my colleagues here told me I only had a few minutes, so that's disappointing because I'd love to wax prolific at length. These are two truly amazing people. When I first met Gary, he described himself as a successful businessman and didn't expect to retire. And I think he was trying to beat his dad. If I recall correctly, his dad worked to 102 years of age, and Gary was, I think, intent on beating him. He was diagnosed with Parkinson's disease in 2017, and I think at that point really entered the passion of his life. Within 1 year, he had organized with his family Power Over Parkinson's, which is a not-for-profit focused on providing financial assistance and connecting Parkinson's patients with the resources they need. And thanks to Gary and Margaret's vision, both for POP, but also for larger support of Parkinson's in the community, they've established a strategic partnership with us here at VCU Health. I think they've served as inspiration for us, and they've been very giving with their philanthropy, and this has really allowed VCU Health to partner with POP, not only on things like this webinar, but in our Parkinson's Center more broadly. I would be remiss in not acknowledging that Margaret is a graduate of Virginia Commonwealth University. She graduated in 2005, and I think Margaret's probably the boss of the operation if Gary's the vision of the operation. And we're super proud to partner with them, and I know Gary and his wife Angela are very proud of Margaret as well. So with that abbreviated introduction, Gary, Margaret, maybe you could just take a moment to describe a bit about your mission, what's going on with POP, and how you're supporting our Parkinson's community.
Gordon, thank you very much for that kind introduction. I really appreciate it. Yes, I'll try to make it to my father's age of 102 at this point. But POP came about, Power Over Parkinson, the foundation, because we wanted to focus on improving the quality of life of others with Parkinson's disease. In that, we formed POP, as we said, and we provide financial aid, try to add more opportunities for socialization, and add more opportunities for physical exercise for the Parkinson community. That's our total focus, those three pillars. With that, I'll turn it over to you, Mark.
Yeah, once my father was diagnosed and we really established, we saw a little bit of a gap in the Central Virginia area for support and just overall community. We established our mission just to get out there and help other folks with Parkinson's disease. We established our mission and kind of started slowly creating programs. Our first and most coveted program would be our research chair with VCU, to study the effects of exercise on those living with Parkinson's and the symptoms associated with the disease. Our second initiative that we're also very proud of is the Parkinson's Activity League. That's on hold right now with the quarantine, but was meeting about on a monthly basis to get people out with Parkinson's and their care partners free opportunities to bowl, go to the driving range, range, and just kind of experience that physical movement alongside of other people with the disease. So feeling comfortable and getting that crucial socialization piece. It's just as important as, like we talked about, taking your medicine and seeing physical therapists, etc. That socialization is so important. Another initiative that we focused on is just simple fundraising. So earlier in the year, we had a fun sock hop. We have a golf tournament, fingers crossed later in the year, to raise those dollars to give back into the community with those with the disease. And then just some things that we focused on during quarantine. Of course, everything was screen driven. So creating a YouTube channel of workout videos and physical therapy videos that our folks at VCU have helped us with. We're excited to have that for folks. We've created pop profiles where we're profiling different people with Parkinson's to share their story. The Parkinson's the Parkinson's Advisors Group, to help people who are newly diagnosed. So people with Parkinson's talking to others with Parkinson's, and hopefully just offering a lending ear of support. And of course, all of these and more, we hope to keep moving forward after quarantine and keep establishing these partnerships and just add more to the community. So thank you, Dr. Smith, for giving us this opportunity to share a little bit about our foundation.
Well, that's really amazing. You know, it's a tremendous amount of work, and to think that you've built this in such a short time is really quite inspirational, actually. So let's get at it. Let's go ahead and introduce our panelists and start the discussion. For patients with movement disorders and Parkinson's, it's critically important to, find ways of pursuing health, wellness, and fitness in any time, but that's particularly challenging in the current environment with our shelter in place and the need for social distancing. I think VCU Health and with what you'll learn in the coming moments is really focusing on this, and I'd like to introduce you to the team that's doing that. And because they're all really awesome, I'm going to introduce them in alphabetical order. So the first is Dr. Matt Barrett. He's an associate professor of neurology at VCU Health. We were fortunate to recruit Matt from UVA. He has a research interest in genetic factors that influence cognitive and psychiatric symptoms in patients who have Parkinson's disease. I think we're all inspired by our patients. He's attributed his patient-centered approach to treatment to his grandmother who had Parkinson's disease and never let it define her. Next in the alphabet, Dr. Leslie Cloud. Leslie's the director of our Parkinson's disease program. She has a research focus on developing new therapies for non-motor symptoms of Parkinson's, which can be particularly problematic and disabling for patients. She's working very closely with Gary and Margaret and our friends at POP on ways that VCU can more fully integrate new resources like exercise and wellness in our standards of care. Next in the alphabet, Bobby Hand. When I moved here a couple of years ago, I started to hear a lot about this mythical physical therapist in the community named Bobby Hand, who's a bit of an icon to Parkinson's patients. And so it became my mission to get him on our team, and we were fortunate enough to be able to do that. Bobby's very well known to the community. He's a licensed physical therapist. If I'm correct, Bobby has the chemical structure of dopamine tattooed on his arm. I hope that's okay to share. That's the level of commitment he has. So he is our program coordinator and works very closely with Pop and Gary and Margaret. And last in the alphabet, but not least in any way, is Dr. Sarah Logan. Dr. Logan's an associate professor of neurology. She's one of two neuropsychologists in the department who are really focused just on the care and research for patients who have Parkinson's and movement disorders. Her work is really focused on evaluating cognitive movement, or rather mood, quality of life interventions for patients with Parkinson's. And she also has an interest in caregiver needs. So the way this will work is each of our outstanding speakers is going to talk a little bit about their topic. We've had some questions submitted ahead of time, and we'll select from those and questions that may be coming in after each one. And then after that discussion, we'll open it up and have time for all of you to ask questions. So Matt, why don't we start with you?
Gordon, I'm going to take a more traditional approach to wellness and talk about it in regards to what we normally think about with Parkinson's care, or maybe first think about medications and interaction with the neurologist. So to start with medications, I think it's always important to maintain a regular medication schedule. I think with change in routines and perhaps with the current situation, people may have more difficulty maintaining that regular schedule. For some individuals, it's really important how they take their medication in relation to their food, because protein can interfere with the uptake of levodopa into the brain. And so with being in the house more, changes in dietary patterns, this could be more difficult to maintain. So for those individuals that notice that difference in response to medication, it would be really important that they pay attention to the schedule of their medicines with their food and their meals. Keeping up with refills may be a little bit more difficult. I think now we've all had a couple months to adapt to the new situation, but at least up front, and maybe it's still the case, it would be important to give a little more lead time, just due to changes in clinic flow and maybe even on the pharmacy end. I think a lot of people have already explored delivery options in the past, but certainly now is the time to do that if you haven't already. I think a lot of pharmacies will offer that, or even curbside pickup, but it's just one way to maintain physical distancing. In regards to clinical care, contact with the clinic may be a little different. Again, this is something that I think was more the case a month or two ago. We are starting to normalize our clinic operations more and more, but there still may be some differences in how you would get in contact with the clinic. It's always a good idea to have clear lines of communication. In many cases, this means via phone calls, but I think more and more people are using the portals that are linked to medical records. I think that's a really great way to get in touch with the clinical care team, especially for more simple issues. In case of emergent issues, then phone may be the best, or even some other route. It's also probably important to, or it is important, I think, to maintain regular appointments. So a lot of us put many things on hold over the last couple months. What we could, at least, I think moving forward, it's still going to be a fairly fluid, dynamic time over the coming months. It's still going to be important to have some regular contact with your providers, neurologists, but even other doctors. So a lot of that, fortunately, can now take place via telehealth visits. So the Department of Neurology and VCU, but the Department of Neurology especially, has been really aggressive in transitioning care to telehealth. Up front, at the beginning of this in March, that happened on a very short time scale. Of course, it's been, maybe not relaxed is the right word, but we've started to move some patients back into the outpatient environment, especially new visits, I think, are one priority for that. But certainly for follow-ups, I think there's a continued commitment to see people via telehealth. I think for neurologists, maybe outside VCU or other medical providers, if possible, if you're not being offered a telehealth visit, I think it's fair to advocate for that, especially if it's a follow-up visit and it's a provider you have already established a relationship with. So video can be important for, well, I think video in general is better for a telehealth visit if you can handle that, or if that can be managed. It may not always be necessary, but certainly is helpful. Moving away from Parkinson's disease, I think it's also important to just emphasize that you have to maintain contact with all your other medical providers and take care of all the medical issues that outside of Parkinson's. So that may mean maintaining those same kind of clinic contacts that you had previous to COVID-19. For certain medical issues that you would like to delay, I think it would be good to speak with your physician or another provider before making that decision. This is a good time to lay out this general principle, which is any time with Parkinson's disease that there is a sudden or rapid change in symptoms, and by that I mean a worsening in Parkinson's symptoms, it's always good to suspect some other medical problem or issue is causing that, rather than a worsening in the Parkinson's symptoms itself. I don't think this has been clearly laid out there in the experience with COVID-19, but a worsening in Parkinson's symptoms can indicate an infection. I think in the case of a respiratory infection, you would have other symptoms along with it, but it's just something to keep in mind that sudden worsening in Parkinson's symptoms should probably seek evaluation with your neurologist or primary care doctor. From what we know, there's no increased risk of contracting COVID-19 if you have Parkinson's disease. It would be the same as for anybody else. It would, like I just said, probably worsen Parkinson's symptoms. Anytime someone with Parkinson's is ill, it's probably good to try to maintain the medication schedule as much as possible. That can be difficult in a hospitalized setting. This goes for anything, even other than COVID-19, but it's good to maintain medications as much as possible when there's another illness that could be affecting symptoms. Prevention is going to continue to be the key. I don't need to say it too much because you're hearing it everywhere else, but the two key things are to continue the physical distancing and using face coverings. And I think on our end, what that means is to make the clinical outpatient environment as safe as possible if people do need to come back into the clinic to be seen. So this is a clear priority of multiple medical institutions, but I think VCU Health is, from what I've seen, is doing everything they can to put multiple safeguards in place. This includes a continued commitment to telehealth, especially for follow-up visits, and then maintaining lower clinical volumes. And that may mean a longer clinical day so patients can be seen spaced apart.
Dr. Barrett, thanks for that great information. We received a follow-up question throughout the week as folks were registering, and I'm hoping you can answer this one. It has to do with the symptoms of Parkinson's and what symptoms would require a true face-to-face with a neurologist.
Sure. So Parkinson's disease is a movement disorder, and so sometimes seeing the symptom is really what is needed, or examining the patient. A lot of that can be done on video. So I mean, a specific example I can think of that can't be accomplished over a telephone call is when a patient has increased shaking or increased tremor. That sometimes could indicate dyskinesias, and your treatment for dyskinesias would be very different from a worsening tremor. So just seeing that can be very helpful for making that correct diagnosis and correct treatment plan. Another thing I think that's important from a Parkinson's motor standpoint is that changes in walking and difficulty with gait is really difficult to assess with telehealth visits. I've had some luck setting up the phone or iPad or computer so I can have the patient walk on video, in their home, but there's really nothing that is the same as having them actually in the clinic, seeing them walk in the hallways, but then also being able to perform the other aspects of the neurological exam live on them to help figure out really what's going on with their gait.
So thanks, Matt. That's a really great review. I found it really rewarding to be able to see people in their home environment. I don't know about you, but I've not done a lot of house calls in my past, but this feels a little bit like it. And what I like is you can get everyone on the video as well. So, I'll have video visits where I have family members from other places in the country join us, and I think I get a better sense of the environment in which patients are living. So I think there's opportunity there. Let's go to Leslie next. Leslie, can maybe you talk to us a little bit about other issues that are important in health, so perhaps diet, socialization, recreation?
Sure, thanks, Gordon. Hi, everyone. So there are 3 points that I'd like to discuss today. The first is about the importance of maintaining social connections and relationships despite the current need for social distancing. So socialization is such a fundamental aspect of what it is to be human. And we know that face-to-face interactions with other human beings leads to the release of a whole cascade of neurotransmitters, including dopamine. And those neurotransmitters serve to elevate the mood so they can actually make us happier. We also know that having lots of conversations with different people can actually improve our memory function and can serve to protect our brains against neurodegenerative diseases like Alzheimer's and Parkinson's. And so maintaining an active and healthy social life has both mood and cognitive benefits. So it's important not to let one's social life, fall by the wayside in the context of this pandemic. So a few suggestions on how to maintain socialization. One thing is to do what we're doing today, which is to take advantage of this video conferencing platform, which is available for free. If you have access to a computer or a tablet or a smartphone, you should be able to use it. And so you can host a virtual get-together with friends or family. Many Parkinson's disease support groups across the country have embraced this platform so that they can continue to meet during this time on a regular basis. And I would certainly encourage anyone with Parkinson's to explore that option, because that's a wonderful venue for socialization as well. And then for people who are less technologically inclined, you can safely have a face-to-face get-together with friends and family with just a few measures in place. So my recommendations would be to consider hosting an event outside in your yard instead of indoors in your home, because we believe that to be safer from a contagion standpoint. And you can space chairs 6 feet apart and ask everybody who attends to wear some sort of mask or facial covering, and that would ensure that you're doing everything that you can to make it as safe as possible. The second point that I wanted to discuss briefly is about the many advantages and benefits associated with spending some time outside in the sunshine on a regular basis. So exposure to sunlight not only elevates our mood, but it elevates our vitamin D levels. Vitamin D is extremely important for health and wellness for a couple of reasons that we'll talk about. First of all, vitamin D is one of the most important, if not the most important vitamin for immune system function. And we know from a few recent studies of patients with COVID-19 that patients with low vitamin D levels are more likely to suffer serious complications of COVID-19 infection, and they're more likely to die from COVID-19 than people who have normal vitamin D levels. So it's important from an immunity standpoint. We also know that vitamin D is extremely important to help maintain strong, healthy bones. And that can protect you from a fracture should your Parkinson's disease ever cause you to fall. So keeping your vitamin D in the normal range is extremely important. And it only takes a few minutes a day of sun exposure. The recommendations are to spend 10 to 15 minutes a day around the middle of the day outside in the sunshine. And you just need to have about a third of your body skin surface area exposed. So just wearing a t-shirt and shorts would expose enough skin to give you enough sun exposure in just 10 to 15 minutes a day for lighter skinned people and slightly longer for darker skinned people. So I think getting some outside time is crucial right now. And then the final point that I wanted to make was really just, I really want to urge people to continue to prioritize good, healthy eating habits right now. I think it's very easy at the moment to rely more on shelf-stable foods because it means fewer trips to the grocery store, and that means fewer chances to be exposed to COVID-19. But it's really important for optimal health and wellness to continue to get a lot of fresh food, particularly vegetables and fruits, on a regular basis, because those are loaded with antioxidants that we know to be neuroprotective. And they're also the key component of a Mediterranean diet, which we believe may slow disease progression in Parkinson's based on 2 recent studies that were done. So a couple of suggestions for ways to maybe think outside the box to get those fresh foods without actually physically going into a grocery store. A great option that I have taken advantage of is joining a local CSA where you can get locally grown fresh produce delivered in a box, literally directly to your front door on a weekly basis, and it's often at a fraction of the cost of what you'd pay for the same items in a grocery store. Also, many grocery stores are now offering curbside pickup or home delivery options for a fee. And I actually just learned yesterday that Medicare will actually reimburse you for grocery delivery costs if you meet their requirements for low income. So, you know, you may have to think outside the box a little bit, but try to prioritize ways to continue to eat well despite the logistical challenges involved in procuring groceries these days. So with all that said, I will stop talking and take questions if you have any.
Dr. Cloud, we've received a question asking you, what specific recent developments can you point to that will improve my quality of life with regard to motor issues? Please tell me what ones that are available now and what other projects are there in the pipeline.
Okay, great. So we're very lucky in that we are living in a time where we have seen a large number of new medications approved for Parkinson's disease in the last few years. For decades, it was a drought, really. We didn't have anything new to offer. And then just in the last 4 to 5 years, there's been a bit of a boom. So in terms of things that are newly approved by the FDA and currently available or soon to be available, There's really two categories of medications. One is we have 2 new rescue agents that have been approved. So in PD, a rescue agent is a medication that you take when you feel that your medications have worn off suddenly in between your regularly scheduled Parkinson's disease medication doses. So these are medications that you take on the spot, they work very quickly, and they help bridge the gap until your next regularly scheduled dose. Up until very recently, we only had 1 rescue agent approved by the FDA, and it was an injection of a medication called apomorphine that was never wildly popular for a variety of reasons, not the least of which was it was an injection. So now we have 2 newly approved rescue drugs. One is an inhaled form of levodopa, and the other is a new formulation of apomorphine that's a sublingual administration. So instead of giving yourself a shot, you just place it under your tongue and it's absorbed very quickly. And that will be available around September of this year, whereas the inhaled levodopa has been around for a while. And I certainly think it's improved quality of life for the patients in my clinic who are on it. And then there are also a variety of other newly approved medications and medications in the pipeline in phase 3 clinical trials that are intended to be adjunctive treatment for Parkinson's disease. So they're meant to be added on top of existing medications to improve on time throughout the day. And there's a variety of those that work in different and novel mechanisms. I won't go into too much detail there, but I'll just say that many of those phase 3 clinical trials are being done here at the VCU Parkinson's and Movement Disorders Center. So if anybody had an interest in exploring those options, you can reach out to us at any time and we can talk to you about those trial options for new medications. Does that answer your question, Gary?
Yes, thank you very much. I appreciate it.
You're welcome.
Leslie, that's great. And I'm going to go off script. It usually doesn't take me long to do that. So I hope I don't get in trouble, but there are a couple of questions I thought maybe you could address right now. So are there specific vitamins that you recommend for patients with Parkinson's? What sort of vitamins should they be taking? And what about checking vitamin D levels at a clinic visit when you're seeing your Parkinson's doctor? Should that be happening?
Both excellent questions. So there is not a one-size-fits-all prescription for what vitamin supplements you should take. Truthfully, the answer is, you may not need any. What I recommend that people do is once a year, at least, your primary care provider should be checking your vitamin D levels to make sure that they're in the normal range. And if they're not, they can look at how low they are and determine the best way to give you a supplement to get you up into the normal range. If you do not have a vitamin D deficiency, there's no reason to take a vitamin D supplement. You should just get some regular sun exposure to keep your levels in the normal range. There are some other vitamins and minerals that can potentially be useful for some people with Parkinson's disease. Again, this is not a one-size-fits-all. It's a case-by-case situation that you'd have to discuss with your provider. But for people at risk for osteoporosis or with osteopenia and osteoporosis, taking a calcium supplement along with a vitamin D supplement can help keep the bones healthy, which can be important. And then everybody over the age of 50 is at risk for vitamin B12 deficiency. It's just a phenomenon that we see with age. And if you have a low vitamin B12, it can cause a variety of neurological problems. And so again, a primary care provider should be checking that once a year and supplementing if it's low, but if it's normal, there's no reason to be on supplementation. I think the short answer is no. There's not a list of vitamins that everyone should take, but these are conversations you should have with your primary care doctor and with your neurologist to determine if you do have a specific need. And then Gordon, the other part of your question was what? Could you remind me?
So should our patients with Parkinson's be having their vitamin D level monitored over time?
Yes, once a year at least. I think all adults should have their vitamin D levels checked to make sure you're staying in a healthy range.
Well, thanks, Leslie. I particularly like the sunshine piece of that. So it makes me feel better about that. So next, let's go to Dr. Logan. Sarah, could you talk to us a little bit about techniques to manage mood and cognitive symptoms patients with Parkinson's disease might have?
Absolutely. Thank you, Gordon. I'm excited to share with you some additional activities that are especially good to use at home. Physical exercise is really key in Parkinson's, but there's a lot of other activities you can do that help improve cognitive changes that you may notice and or mood changes. And so we're going to talk about those for a few minutes today. And I'm actually going to guide you through several exercises briefly too. A lot of the activities I'm going to talk to you about really help address focus and attention problems. They can also help you relax better, sleep better, and lower your anxiety. And so they can help a number of symptoms. The first one we're going to go through, there's a lot of relaxation techniques that are helpful, but I want to guide you through 3 of them, show you different ones. Deep breathing is something we generally tend to breathe very shallowly and just in our upper chest. But if you actually sit and really focus on taking a deep, full breath, belly kind of out a little bit because your lungs are filling your belly moves a bit. That would be really deep breathing. And you would practice that by doing an even inhalation and then an exhalation. So you don't want to kind of strain. You don't want to suck in and strain getting air in. You just want to do it gradually and hold it as long as you're able to, and then exhale it at the same rate. And so you would breathe in, 1, 2, and then breathe out, 1, 2. Just doing a little bit of that breathing, you'll notice it sends your body through various areas, relaxation to the rest of your body, and can help you de-stress a bit. Another activity that people enjoy, first I should say that deep breathing you can do anywhere. So you can even do it in line at a grocery store or when you're waiting for something. No one will really know that you're doing this. So you can practice it at home, but you can also do it in public. The other 2 would be better done at home, and guided imagery is one where you go in your mind's eye to a relaxing place. So that could be a beach scene or a mountain scene. It can be real or imagined. I do encourage you not to have other people in that scene. And typically things that you look at online will guide you through your 5 senses. And so doing that helps you relax. You can do deep breathing with this, but go through what you can hear, see, feel, touch, and smell. And you can do that for 5 minutes all the way to 15 or even longer minutes, and have a good relaxation response. Progressive muscle relaxation is another technique, and that one is one where you actually tighten the muscle and then relax it. Some people with Parkinson's don't enjoy the tightening part if they have some rigidity. So I've had patients actually just do the relaxing part more, and you can modify it like that. But that comparison can help people then feel a deeper release and realize they're holding tension in their neck or their back or wherever. That one in particular, some people have told me has really helped them fall asleep if they do that from head to toe or toe to head, and it helps them drift off to sleep. So another type of breathing exercise that's called intentional breathing, I wanted us to practice together. And we can just do that for a few minutes. But intentional breathing is where you breathe in deeply through your nose, hold the breath, what's comfortable, but maybe 2 to 3 seconds. And then you want to exhale like you're breathing through a straw. So, and you might hear a little noise when you do that. So if you practice with me, you'll breathe in deeply through your nose, 1, 2, and then exhale and push it out through your pursed lips. Do that again where you take a breath in, 2, 3, and let it out with the pursed lips. When you do this, you may notice some of your shoulders dropping or sort of a heaviness in some of your limbs. Just that focused breathing can help you get that relaxation going. That's a really quick exercise that you can do anytime you feel anxious, but you could also do it before you do something more focused that you want to be mindful about, or to help you fall or return to sleep. Because again, it's going to get good oxygen to your body and also help you de-stress. Another area that we won't go into in depth too much today is mindfulness, and that's quite popular. Mindfulness can help improve attention and focus, but also reduce anxiety, judgment about your symptoms, negative thinking, and increase compassion. And really, mindfulness is about being fully aware of whatever is happening in the present moment without filters or the lens of judgment. And so you cultivate awareness of the mind and body and live in the here and now. And that can help you slow down a bit, but also relax. One of the main techniques that's used in mindfulness is called a body scan. And that's where you would actually, similar to what other techniques we've talked about, you would sit or lay down and focus on relaxing things from the top of your head, maybe your chest, your arms, your sitting posture, your sitting bones, and your legs and your feet. You can do these for as long as an hour. Some of the like pre-programmed apps have that, or they can be shorter. They usually are a little longer than some of the other techniques I just talked to you about. But I think a body scan can be a good way to address sort of tension you feel in a specific part of your body. We actually did a study at our center and found that mindfulness did help people with Parkinson's have better attention and improved mood. And we used a variety of sources, but two that I wanted to mention, and you can always reach out to me about them, but is the mindfulness-based stress reduction workbook. And then there's also one that's specifically for anxiety. These are guides that help you walk through what we did in a group format, but help you learn more relaxation techniques and address symptoms that may trigger you and how to handle those. So I'm happy, if you have any questions, feel free to email me and I'm happy to share more of those resources. Thank you.
I'm going to go off script, and my father was doing some of the exercises, and now I have to keep him awake. So, so I'll make sure I poke him a little bit along the way.
We all probably could do deep breathing. Yeah.
Thank you for that great information. And I wanted to ask you, we were actually from one of the participants, and the person writes, I have been recently diagnosed with Parkinson's and feel overwhelmed. What is available to me?
Absolutely. And this is something we hear very commonly. When you're first diagnosed, it's so much information and it's trying to figure out what applies to you. One of the first things I would say is it's really important to get a movement disorder neurologist evaluation. A general neurologist may not have that much experience with movement disorders, and so it's worth making a trip to get that. You may be later able to modify your care if you're distanced from somewhere that's hard to do, but at least get evaluated by a specialist. And I always tell people, your movement disorder specialist is actually the best at telling you about your symptoms. When you go online, you're going to find millions of things. Some are accurate and some are not. And I do encourage people to really be sure you look at vetted sources. So our website or medical institutions that have credibility you want to look at. But you should also realize many of those symptoms may not apply to you. So I don't want you to go look for information and just get so overwhelmed you don't know what to do. Our website is the www.parkinsons.vcu.edu. And one thing in there is that you can read about the specialists that we have in our interdisciplinary clinic, but also community resources. There are a lot of resources in the state of Virginia for people with Parkinson's, support groups for patients and caregivers, as well as exercise classes, including your programs that are so critical. In those types of activities, I think it's great to meet people who have gone through similar experiences, but it's important to recognize they may have a symptom or a trajectory that's different from yours. So I always caution people, don't be alarmed to see people with maybe more problems. They may have other medical problems or not have a good response to treatment for some other reason. So don't take that as a prescription that that's what's going to happen to you. So on our website, we do have education, community research, and patient care resources. And really then a movement disorder neurologist can refer you to speech, neuropsychology, physical therapy, or occupational therapy, but you probably won't need to see all of them at once. So I wouldn't get overwhelmed, but just address what symptoms you have as you need to. Social workers are another good piece of a team in that they help with long-term care decisions, disability, and insurance questions. So there are a lot of good resources. You just have to, and I'd say just chip one thing at a time. Don't get overwhelmed.
Thanks, Sarah. That's a really great review of the different resources available. Let's turn to Bobby, batting cleanup here. Bobby, what do you think about the importance of exercise, both in general, but what about this current kind of strange time in which we're living? How should folks be thinking about that?
Sure, thanks, Gordon. I cannot underestimate or understate the value of exercise in not only our physical well-being, but our emotional and cognitive well-being. So we're all in this boat together, and that many of our routines have been altered. We can no longer get to the gym or go to some of these community classes, such as those offered in Richmond with Rocksteady and other Parkinson-specific programs. And that's hard for individuals and families living with Parkinson's because it's often considered such a structured disease, and that you have to take your medication at a specific time and you get in a habit of doing your exercise at a specific time. And all that's been turned on its head. So now we have to figure out how to best maintain our physical activity levels when we can't go, to the YMCA or to go walk with friends like we used to. And I think that the biggest barrier to maintaining an active lifestyle right now is this belief that you can't do it anymore because you've lost that old normal. What I mean by that is you no longer have the equipment available or the space available, so you have to get creative. So some equipment or environmental changes, if you take them correctly, you can perform high intensity exercise in the comfort of your own home. So some things that I've worked with patients recently on setting up the home or setting up equipment include using a milk jug as a weight. So we all have milk or water available, hopefully, that we can perhaps use that as a recycled exercise weight, or a broomstick for many of the activities we use to work on posture and mobility. And when it comes to identifying a good space in your home, it's really nice to get it away from the areas you associate with rest. So I don't recommend people do their strength training homework in their bedroom or maybe in their office or their study, but perhaps in more of an open area like the living room. And typically those areas have furniture available that we can use for support if needed, but also just the floor space so that you're not putting yourself at risk for tripping or other injury. So once we've identified some equipment modifications and space changes, we can really focus on the actual strength training or exercise programming in those areas. So many of our patients are engaging in body weight exercise routines, but we're changing up the way that they perform the exercises. We can work on endurance by doing them slow and steady. For example, practicing standing up from a chair, for a set of 15 or 20 repetitions, or setting a timer on your clock and seeing how many times you can do it in 2 minutes or 3 minutes. And then the opposite, moving fast and furiously, trying to do an activity quickly and set new records, logging your own performance. And that actually brings me into my next point that I jotted down here. I am going off my own script because I never like to stick to that. I think the biggest potential barrier here is the motivation that we receive from working in a group. So the Parkinson's Activity League, or even just that back and forth interaction with your therapy team. We have to find an internal motivating factor. And for many of us, we actually don't write down our goals, and that's one of the best means of tracking performance and holding ourselves accountable. So I cannot say it enough that I recommend you write down goals, but take new goals, based on this new normal. So the goals that you had as of February 2020 are maybe no longer applicable. We have to make new short-term goals. So make sure that they're specific to you and your needs, that they're measurable, that they're achievable. And by an achievable goal, I don't take anything off the table. But if you tell me that you want to move like you did when you were 30 years younger, that's kind of hard. I can't fix aging. I can maybe modify some of the effects of it with exercise, but make it an achievable or realistic goal. Make it relevant and put a time to it. So given the state of affairs right now, I think it's realistic for us to set 1 and 2 month physical performance goals. And then we'll reassess as we learn more with this situation. And now the final piece I wanted to address with my notes here it's really challenging for us to work on cognition or balance when we're by ourselves, because there's that innate fear of falling, or if you're trying to challenge your mind, it becomes a bit overwhelming for you to not only be doing the activity, but be prescribing it. So one of the things that I've been sending to a few people recently would be the recommendation of a whiteboard or pseudo whiteboard that you can write out some instructions to yourself. And for nothing more than, or with nothing more than a deck of cards, we can come up with an entire cognitive and mobility exercise routine. And the way that we can do that, I'll just show you real quickly here. Something as simple as taking I've got Bugs Bunny cards, but a black card and a red card, and we assign different tasks to each. You write them on the whiteboard so that you can hold yourself accountable, but you shuffle up and deal. And let's say you want to just draw one card, or maybe you draw 3 cards in a row. Can you remember the activity that was associated with it and then perform them correctly? So yes, it is nice to have someone there cueing you and prompting you and cheering you on even, but sometimes we have to take things into our own hands. And I think that that type of strategy where you're writing out the activity can be really useful in this current climate.
Bobby, there's a question that just popped in. It's probably got 3 parts to it. Given the current social distancing rules, how effective is physical therapy at this time? How do you handle one-on-one appointments? And finally, are video appointments effective?
Sure, thanks, Gary. To address the first part there, as far as the effectiveness of physical therapy, I think right now it's as effective as ever. I still see physical, occupational, and speech therapy providers as a crucial part of your Parkinson's team. Though our role might be shifted a bit in that we can't see you as regularly, well, moving into the second piece, we actually can. We've started offering one-on-one appointments back at the VCU Now clinic, and many other local providers are doing the same. Now, it is a bit different in that our hours may not be what they once were, or the regularity of your schedule may be different, but I think it is entirely plausible to get all of our people with Parkinson's safely into the clinic following precautions and recommendations established at VCU and through the CDC and World Health Organization to get you in for a session. And I think that's really important, because that third piece with video treatments, if you've built a rapport with your provider, as Dr. Barrett mentioned earlier, sure, video check-ins work really nicely. If you and I have been training together for 2 or 3 years and we're just making some small adjustments, I'm more than happy to meet with you by video. But if you're a new patient with Parkinson's, or you've experienced the change in medical status, maybe you're feeling a little bit unsteady on your feet, it really behooves us to meet in person. And then maybe from there, we can do video follow-ups if that best suits your needs right now. So in summary, physical therapy is still the best. It's still very effective. One-on-one appointments are available upon scheduling through VCU, and check with your local providers. And video appointments have their place in your plan of care, but whenever possible, really try and maintain a direct line of communication with your therapist to determine if video is a suitable option for your needs.
Thank you.
Thanks, Bobby. That was helpful. Thanks to all of our panelists. So we have some time left for additional questions from our other participants. So to do so, please use the Ask a Question feature, which is in your Zoom toolbar, and type in the question you have, and we'll answer as many of these questions as we can get to, and we hope to be able to respond to you answering any questions you've submitted that we haven't been able to get to after the event. And maybe there was a question that came through that I'm going to ask Leslie. I love this question. I don't know if you have an answer, but you talked about the importance of diet, Mediterranean diet, fresh fruits and vegetables. Do we have resources for recommendations regarding community-supported agriculture or other places where patients with Parkinson's can access this? Sometimes it's kind of hard to come across really good food. Do you have any recommendations for us about that?
Yeah, so if you just Google, go to any search engine like Google and type in CSAs in Richmond, Virginia, you'll get I actually found mine through a top 10 list of Richmond's top 10 CSAs that I think was the first link that came up when I Googled it. And you can, pick and choose whether you want just fruit or fruit and vegetables or just vegetables. So there are a number of opportunities available that way. There's also a lot of local farmers markets, which, all over town, there are different small farmers markets that, you can attend that are outdoors, so they're safer. They're generally, very sparsely populated with other people. So it's probably a lot safer than going into a grocery store to try to acquire produce. And that's another thing that you can, easily Google. Just put in your zip code and farmers markets, and you can, easily find the closest one to you. So I think those are, the best places to start. But regardless of what part of town you live in, I'm sure there's opportunities for both nearby.
That's great, Leslie. I'm going to ask you who you use afterwards. I guess it's probably unfair to announce that on the webinar, but I'm keen to know. So we have another question that came in. Bobby, maybe you can help us this one. So our gym just opened, and I'd like your opinion about my husband returning there when he's over 70 years old and has Parkinson's. It makes me nervous about the chances of him contracting COVID. I'm considering getting a recumbent bike instead of returning to the gym. I'd like for him to return to Rocksteady boxing, but I'm concerned about that too. So maybe, Bobby, you can take a swing at that, and maybe, I don't know if maybe Matt, if you want to talk a little bit about COVID risk at the gym.
Sure. Well, I'll just dive in and say that I can't speak for, outside facilities and things of that sort, but anytime that it's a facility or organization that's led by physical therapists or other healthcare providers, such as in the case of Rocksteady boxing, you're more likely to be closely adhering to the recommended precautions, and you have to trust that the physical therapists associated with Rocksteady are doing the same things that we're doing here at VCU now to ensure patient and provider safety. Now, when it comes to purchasing equipment, for those of us that have those means, I highly recommend it. The idea of using a recumbent bike or a treadmill at home, as long as it's been trialed with a therapist or another exercise professional, I think it's a great way to maintain activity levels at a higher intensity. So if you can do that, definitely go for it.
Matt, any thoughts regarding just COVID risk and how to manage that?
I think, there certainly are greater risks in enclosed spaces and the number of people in any given enclosed space. So gyms can have that problem of increasing COVID risk. I think it may not be a bad time to explore some other modes of exercise, or at least to use them more than in the past, like tennis outdoors, certainly if it's shaded, or maybe to get back in the pool. I think, a lot of pools are putting in measures that would help limit the number of people, certainly in a lane, and that would be in a pool at any given time. That's probably something that's a little safer than actually being in a gym. The challenge, I think, gets to be whether people are comfortable wearing masks as they exercise. If everyone could wear a mask while exercising, I think we wouldn't have too much concern. Certainly a medical style mask would be easier to breathe through. I think these cloth masks, can be pretty difficult to breathe in, especially if you're exerting yourself. So I think that's where really the challenge gets in is, can you actually exercise with a mask? And if you can't, then a gym is going to be really challenging.
Gordon, if I may add, don't forget the important issue of socialization. I realize there's risk in going to a class, but having someone that having Parkinson's disease, I realize the importance of socialization, which balances almost half the ability of the class too.
Yeah, Gary, I think that's a really interesting point. Sarah, maybe you could talk about this because, I certainly have observed the impact of social distancing on patients. I'm in the hospital now, and, it's very hard for our patients in the hospital because they don't have their loved ones surrounding them. Do you have any thoughts or tips or tricks for patients who are sheltering in place and don't have the same access to in-person social networks?
It is a real challenge, and I think we've all felt that, and people with chronic illness or other issues may be more prone to it. But I think it's really critical to reach out. And I also think I've talked with a lot of people about scheduling things for routine interactions. We can mean to do things, but days and weeks go by and nothing happens. So I would encourage people, especially if you're trying to do as much stay at home, that, like we were talking about, you can still do outdoors where you set chairs far apart. Or I know people who stay inside their home and talk through an open window with people that are outside on a porch or something like that. But I do think even phone calls, regular, can be very helpful. It is nice to have the Zoom capability, or if you can figure it out on your phone where you can face chat to see people. But I would think about, I often talk with people about look forward to something every day, every week, and every month. So you need people that you're connecting with regularly in those different time frames so that you're not alone and just struggling with that. So.
Yeah, thank you, Sarah. So we have time. I'm going to squeeze in one last question, and this one, Leslie, maybe you can help us with this one. Is Parkinson's disease genetic? And should those who are closely related to a patient with Parkinson's be tested for Parkinson's disease?
I am happy to answer that. I also think Matt Barrett may want to comment as well, since this is a particular interest of his. But for most people, I think the simple answer is probably not. Folks with young onset Parkinson's disease, so people who get their Parkinson's disease in their 20s, 30s, and early 40s, are more likely to have a genetic form of the disease. But we do not routinely recommend testing family members of everyone with idiopathic Parkinson's disease. In fact, we don't routinely test everyone who is diagnosed with idiopathic Parkinson's disease. Matt, did you want to add anything to that?
I agree with that. I think up until now, really, all types of testing on most people with Parkinson's or their family members have been under the umbrella of research. That may be slightly changing over the next coming years as people start to develop therapies that target some of these genetic mutations, but it hasn't yet really changed clinical practice, which is in large part not to perform genetic testing of patients or their family members.
Great. Well, thanks for that. I think we're having to wrap it up now. We're in the last couple of minutes. So first, I want to thank all of our panelists. It makes me very proud to work at VCU, just listening to this conversation. Really wonderful, and I learned a lot about it. I also want to thank all of our attendees for engaging in the Parkinson's and Movement Disorder Center at VCU Health and for participating in this webinar. And a special shout out to Power Over Parkinson's for joining us today, for Gary and Margaret and their family. I think your contributions are clear to see, and we're very proud to have you as partners in the research and care being delivered at VCU Health. So for those of you who have questions about things that are going on here at VCU and the Parkinson's and Movement Disorder Center, you can check out our website. The URL is parkinsons.vcu.edu. parkinsons.vcu.edu. And Gary and Margaret, where can our friends find you?
Sure. Our website is poweroverpd.org. And we're also all over social media, or are trying to be, via Twitter, Instagram, and Facebook at Power Over PD, as in Parkinson's disease, Power Over PD. And just as a reminder, that'll also be available in the chat. And finally, as Gordon had mentioned up front, the webinar is being recorded, and you'll receive a copy of the recording in your email within a week or so. And we can't thank everybody enough for attending this webinar. We hope everyone's gotten some great information from it, and we're excited again to see everyone soon.
Yeah, thank you. Thank you very much, Margaret. I think one of the defining characteristics and strengths of our center, and really Richmond, is a strong sense of community and partnership we have. We saw that today, and I want to thank everyone one last time and wish you all the best of health and safety. Please take care of yourselves, and I hope we have the opportunity to see you again on another webinar on a similar topic in the future.